As you can see, it's not easy determining what behaviors meet the criteria for psychological disorder. So for example, one psychiatrist defines psychological impairment. That's one of the three criteria defining psychological disorders, and it might be very different than how another psychologist will define it. So to standardize the diagnosis process, the American Psychiatric Association, yes, that's the same people who brought you the APA formatting in your comm classes, has created a manual for mental disorders. It's called the DSM-5 is the current one. The Diagnostic and Statistical Manual for Mental Disorders. We will look at the variety of methods of assessments that clinicians use to arrive at a diagnosis. Assessments will classify, gather information regarding personality and cognition. All information gathered will help recommend the best treatment. Assessment methods must be reliable and valid. Now, validity, that's the extent to which the study or the research instrument accurately measures what it's supposed to measure. If you jump on the weigh scales, it measures weight. Doesn't measure intelligence, doesn't measure creativity, doesn't mention anything about communication skills and things like that. Just weight. Reliability, on the other hand, that's the extent to which the study or the research instrument yields consistent results. You jump on the weigh scales, it measures the weight accurately, every time, sometimes to our disappointment. All right, we're going to start with the interview. Now, the interview comes with, or is, structured and standardized, semi-structured, or it's unstructured. It's the most widely used method of assessment. The clinical interview involves the use of a set of questions designed to elicit relevant information from people seeking treatment. Clinicians generally use a structured interview, which consists of fairly standard series of questions to gather a wide range of information concerning presenting problems or complaints, present circumstances, or history. Now first, a face-to-face setting allows clients to describe their presenting complaints in their own words. Second, the clinician may observe a variety of nonverbal behaviors which also provide clues to the client's personality or problems. And third, the interviewer may orientate the interview to the person rather than vice versa. At the same time, a major disadvantage to the interview is that the data may be distorted by the particular questions asked, as well as the interviewer's personal or cultural bias. Now there's two types of questions. There's open questions, the who, what, where, when, and why, or closed questions which prompt a yes or no. You know, do you like vanilla ice cream? Yes or no is a closed question. What flavor of ice cream do you like and why is an open question. Now we can also look at intelligence and personality tests. These are structured and standardized. They're tested over a large number of people and create certain norms. Measuring relatively stable traits of intelligence and personality, they must be reliable and valid. These tests can provide some insights as to what is normal and abnormal. Intelligence tests help clarify issues of abnormal behavior. It tests intelligence, the Stanford Binet, which is a 1 IQ score for intelligence. We also look at the Wechsler as another one. And these both will measure. Stanford Binet is probably the first one. The Wechsler comes in an adult version as well as a child's version, and they're used for various purposes in clinical assessments, including determining evidence of intellectual delays or cognitive impairments and assessing strengths or weaknesses. Intelligence is expressed in the form of an intelligence quotient or an IQ. There's two types of formal tests to assess for personality. First, there's what's known as the self-reporting personality inventory, like the MMPI, which is how it's known, but it's the Minnesota Multiphasic Personality Inventory. It's used structured items to measure various personality traits such as anxiety, depression, masculinity, and femininity even. These tests are considered objective in the sense that they make use of a limited range of possible responses to items and an empirical or objective method for testing construction. The Rorschach ink blot test and projective tests such as projective personality tests such as the Rorschach and TAT, which is the TAT is the Thematic Appreciation Test, and we'll see this in the next slide. It asks subjects to interpret ambiguous stimuli in the belief that their answers may shed light on the unconscious process. Projective, as well, tends to project your own objectives and needs and desires into the presented stimuli. Concerns persist about the validity of these tests, however. Projective techniques ask for the responses to a TAT card, you can see that in your text, or some other ambiguous scene in a magazine, including one I have, one or more people, like the one I have behind me. Researchers display the picture and ask participants to write a paragraph or so on the responses to the following questions. One question would be something to the effect of, what are the people in this picture doing? They may also ask, what are they saying to one another? And then thirdly, they may ask, how do you think this situation will turn out? When doing this, they then ask the participants to share their responses. They usually find that the responses vary considerably from one person to another, illustrating how each of us tends to project our own motives and feelings into the figures shown. You might point out that it's the common themes in the person's responses to the series of pictures that provide important clues to his or her personality, not simply the responses to the given picture. Methods of neuropsychological assessment help determine organic basis for impaired behavior and psychological functioning. The MRI, or the magnetic resonance imaging, or CT, computerized tomography, can determine both if the brain is damaged and where it is damaged. For example, the Lura, Nebraska test battery, based on Alexander Lura's work, is a sophisticated battery of tests measuring various perceptual, intellectual, or motor skills and performance, testing for brain function, malfunction without any surgery. In behavioral assessment tests, responses are given as samples of behavior rather than signs of underlying traits or disposition. Excuse me. The behavioral examiner may conduct a functional assessment which relates to the problem behavior to its antecedents and consequences, those things that precede the behavior and those things that follow. Methods of behavioral assessment include behavioral interviewing, self-monitoring, use of analog or contrived measures, direct observation, or behavioral ratings. Behavioral assessments focus on the objective recording and/or description of behavior, only what's seen and heard, not what's contrived or imagined. A functional analysis uses an ABC log. A is the antecedents, B is the behavior or what's seen and heard, and C is the consequence or the reinforcer. This is gained from direct observation or a behavioral interview. Another method is what's called self-monitoring. You record or monitor one's own behavior. It's like a diary. It can be very accurate as to what's happening, when is it happening, and under what circumstances does it happen. These need a baseline. This is the level of behavior before treatment in order to compare before treatment and after treatment. Analog measures, well, these can include things like role-playing, where a client can practice a strategy. Some phobias can be used in stages or levels of approaching what's generally seen as a fear. Behavioral rating scales, well, these are checklists which provide data about frequency, intensity, and the range of problem behavior. Cognitive assessments focus on the measurement of thoughts, beliefs, and attitudes in order to help identify distorted thinking patterns. But people at higher risk for developing emotional problems, that put people at higher risk for developing emotional problems. The aim is to identify distorted thinking and replace it with self-enhancing, rational thought patterns. Specific methods of assessment include the use of thought records or a diary, and the use of a rating scale such as an automatic thoughts questionnaire, or it's also known as an ATQ. Measures of physiological function, including heart rate, blood pressure, galvanized skin response, the GSR, muscle tension, and brainwave activity become important measures as well. The EEG measures brain waves, and the EMG measures muscle tension. The brain imaging techniques such as EEG, CAT scans or CAT scans, PET scans, MRI or fMRI, beam or MEG probes can probe the inner workings of the structure of the brain. Now you'll see in table 2.4 on your page 57 and 58, you'll see this as a guide.